Now we'll look at the next issue which we are going to talk about, and this is the issue of spastic hemiparesis. Okay, spastic hemiparesis. So spastic hemiparesis, let's quickly discuss what is a spastic hemiparesis. So this is what spastic. So anytime you hear spastic, it just simply means something is so stiff, out of proportion, so stiff, and it's not looking cool. So spastic hemiparesis, just so you know, is just a neurological condition. Okay, this is where one side of the body experiences muscle weakness combined with spasticity. Okay, so it's often caused by brain or nerve damage. So it's commonly seen after a stroke or probably in a cerebral palsy. So a lot of things could affect the spastic hemiparesis. So like weakness on one side of the body, spasticity, so muscles actually remain in a constant state of contraction, so it will now lead to stiffness and reduced mobility. So also spastic hemiparesis, where there's combination of both. Okay, so causes could be due to stroke, or the sudden interruption of blood flow to the brain, the most common cause in adults. Also cerebral palsy, then traumatic brain injuries like damage to one hemisphere of the brain can also cause it, brain tumors or infections. So symptoms is what there's muscle stiffness and rigidity on one side, there's weakness and reduced coordination in the affected limb, so there's also difficulties with fine motor skills, there's gait abnormalities, all right, and sometimes upper limb involvement is usually much more severe than the lower limb. So it treats using physical therapies just to improve strength and flexibility, occupational therapies where you are training the person for their daily activities and fine motor functions, then medications, okay, then also botulinum injection, just to reduce the stiffness, the rest of it, then medications to also reduce the stiffness of the muscles, then orthopedic intervention and also speech therapy just to make it that the person is still talking very well.